thank you for everyone that's joined us today. We're going to be exploring the topic of addiction. There will be references to how this may present in the workplace. Predominantly, the audience that's attending today and who has joined us will be employees of organisations, the lion's share being Thrive customers. And we welcome you to this topic today. My name's Rich Middleton. I head up the customer success team at Thrive. I've been with the team for around 5 years now. Very passionate about mental health and looking forward to discussing this topic with you today with my co-host, Adam. Adam, if you want to give yourself a bit of an intro, that'd be great.
Yeah, thanks, Rich, and good morning, everybody. Thank you for joining today. I'm Adam Huxley. I'm one of the co-founders of Thrive. By profession, I'm a consultant clinical forensic psychologist. Working with people with substance use disorders or addiction is something I'm very interested in and spent the majority of my clinical career working in services that support people. So yeah, looking forward to today. Thanks, Rich.
Thank you, Adam. So let's get things going. We'll give you a flavour of what we're going to cover. And just to say, there's the webinar chat function that you can use. Got our colleague Ella who is looking at that chat as we go along. Encourage you to ask some questions. We'll try and create some space at the end of the session if we're running to time to answer some of those. And yeah, we'll make the participatory element through the Slido polls that we have. So if you're not familiar with Slido, it's basically a QR code that you can scan with your phone, and then you can participate in that fashion, and we encourage you to do so. So the topics we're going to be looking at, we will first of all get under the skin of addiction, try and understand the prevalence of some of these issues, both within the UK but also globally. We'll be getting your thoughts and opinions on the topic of addiction, and then we'll be moving into some of the potential impacts to individuals, to people around those individuals that are impacted by addiction, and also organisations. Then with the support of Adam, we will walk through recognising some of the signs potentially both in individuals affected, potentially yourself. We recognise that this issue can be a triggering issue for some of you, and we will be signposting to some of the resources that are available to support you. And then we'll finish off the webinar with looking at some of the strategies, and hopefully you can contribute to that discussion that employers can implement to support people that may be impacted by these issues, with a call to action at the end as well to download the Thrive service if you have not done that already. So that's the sort of shape of the discussion. We'll try and make it conversational between Adam and I. And we'll start by highlighting some of the resources that may be of help to individuals that are impacted by this topic. So this is not an exhaustive list of organisations. There are many good organisations out there. We recognise that some people may have to drop off later in the call, so we do like to sort of start the session with creating a bit of visibility of services that may be of help to individuals that may be on the call, people that you may be close to, colleagues, etc. And of course, there's the NHS. We have our own service in Thrive in respect to mental health support, and you will get a video recording of this and the slides to go with as well. So we'll move in to the sort of main part of the discussion, and hopefully those resources are helpful as visibility of onward support. So I want to start unpacking this topic a little bit. So we'll look briefly at the prevalence of these issues. And again, we've not used a sort of an exhaustive list of data points and resources to do this, but when we did put these together, there's a couple of stats that kind of caught my eye that I did want to sort of explore. And then we'll look at some of the potential challenges to individuals as a result of addiction, and we'll walk through some of the treatment options and the elements of recovery that are possible by being impacted by these conditions. So to give my voice a bit of a break for a second, and for you guys to engage in this discussion, we'll start the ball rolling with the first Slido poll. So the question is, when you think about an addiction or addictions, what words and behaviors come to mind? So you can scan the QR code with your phone, or you can go to slido.com and enter the hashtag that you can see on the left-hand side of the screen. So just encourage you to engage in that, and we'll give it a second for people to start participating and engaging. So this is a word cloud, so whatever people kind of type here will come up, but it's all anonymous to the individuals themselves. So we've got impulsivity, repetitive behavior, compulsive, disease, mood and attitude change. Thank you for engaging this. Denial, aggression, out of control. Words associated with moods, unhappy, emotions, anxiety and depression, and people acting out of character. Is there anything, Adam, from your perspective that kind of stands out, or these kind of anything from the audience's participation that sort of strikes a note?
Yeah, I mean, please also just keep adding to those. I think there's some really good examples there of this topic that we're going to talk about today being associated with harms and risk. So we are going to spend quite a bit of time thinking of addiction as a behavior or an activity that creates a lot of harms. And just as we're talking about, that coping mechanism pops up. So we'll get into that a little bit later on, but oftentimes people might engage in a behavior as a way to cope. But as you can see from some of the other words, these are things that can quickly get out of control. So we see a sense of losing control over this activity, this behavior cropping up a number of times that begins to cause some harm. So yeah, there's a theme emerging from what you've said there about losing control, it being associated with some risk to the person, and obviously having an effect on the way that you think and feel about things.
Thank you, Adam. And that coping mechanism being so prominent says that we've got quite a few people that have kind of highlighted that as something that comes to mind. And thank you for the broad range of things that you've mentioned there and participating in that. So if we look to define this, and this is from the NHS, addiction is defined as not having control over doing, taking, or using something to the point where it could be harmful to you. And I think kind of mirroring the previous slide and the poll, there's many elements around losing control, that sense of doing something to an extent where it could be damaging to you as an individual. So if we move on, the prevalence of these issues, one thing that kind of really caught my eye is in the bottom left-hand side of the screen. Not just the prevalence of the issue, this is in the US, but the age at which some of these substance use disorders can start to appear. 12 plus, Adam. I mean, I don't know if I'm living in a bit of a bubble here, but that seems a really young age for individuals potentially to be impacted by substance use disorders. So that's something, I don't know whether that, from your sort of clinical experience, whether these issues around addiction tend to be quite entrenched, affecting people over many years of their life. Whether there's anything to kind of, to comment on that.
Yeah, I mean, it does seem high, doesn't it? I mean, the thing I'd say about any statistic is that you have to understand how they've been generated and collected. So oftentimes this will be self-report. So it may well be people who've chosen to tell you about a problem. So you might even think it's higher than what we're seeing here because as we'll, I'm sure, talk about quite a bit, there is often stigma and shame associated with acknowledging that you have a problem, whether that's a mental health difficulty or an addiction difficulty. So we only know what we know. So there's probably a larger group than what we see there. But yeah, I mean, one of the sort of theories around how somebody develops a problem with a substance is this concept of gateway, which relates to early onset. So oftentimes people in services as adults will tell us that they experimented very early on, and that I think downward spiral was a term somebody used, and that's a really good way of describing it, that that use became more entrenched and accelerated and then became a problem. Not everybody that experiments with substances goes on to have a problem, but it's clear that for some people, that concept of spiraling out of control exists for them, and they carry on misusing substances throughout quite lengthy parts of their life sometimes. The other thing to mention is that, you know, our understanding of these things is culturally and historically defined. So I think disease popped up again in the word cloud. And if you look at what we might use as clinicians to identify disorders, the ICD-10 is now ICD-11, and DSM, you will see that they're both characterized as sort of diseases that have a biopsychosocial component. And we'll talk a little bit more about that later on.
Yeah.
I'm just wondering what you think, and maybe you can pop your observations in the chat, whether you're surprised by that or whether you think that that's not surprising at all, given your own experiences and what you've seen around you. And we've put some data up there from different parts of the world. So I wonder if there's some geographical differences in terms of prevalence, or even how you get to know about it, because there are different legal frameworks supporting the use of substances across the world as well. So that may have something to do with it.
Yeah, we've got a couple of comments in the chat. One being I'm not surprised, but sad, and one relating to particular drug ketamine and an increase in usage of that over the last year, and that being a worrying stat. The other thing I was looking at here, and I guess you could draw some parallels with mental health prevalence and people within treatment, is the top left stat around this prevalence, albeit from 2021 from the UN, but only 1 in 5 receiving treatment. And whether that draws similar parallels with the amount of people experiencing mental health challenges rather, and not seeking support for whatever reason, whether stigma plays a bigger role or a similar component in something like addiction. But yeah, lots of people that potentially need support not getting that support. And we had a couple more comments in the chat, not being surprised at all. There is a stigma of speaking out or seeking help for addiction. So hopefully more awareness and conversations like this. And when we think about the environment of employers within organizations, we certainly work with other customers who do speak on this topic in various different ways. And I think having a narrative and a discussion on it and creating awareness is part of the solution to this. So we'll move on. Thank you for engaging in that. So again, back to you as the audience. We want to get your thoughts on what are some of the possible causes of an addiction, what might lead to that, and then we'll sort of share our own thoughts and reflections on that. So same principle again, scan the QR code and get involved. A few themes coming up for people: trauma, we've got illness in the chat, stress, grief, your mind, neurodivergencies, financial problems, divorce, depression, mental health. Trauma being quite prominent here. Bereavement coming up in the chat as well, being bullied. And again, back to coping mechanisms. Give guys a couple more minutes just to contribute. Genetics is an interesting one, Adam. We know there's parallels to be drawn between genetics and the onset of mental health challenges potentially. It'd be interesting to hear your thoughts around the role of genetics and whether that leaves people more predisposed to developing addictions.
Yeah, I'll maybe just talk through as some of the other points come in. Yeah, I mean that's it's really helpful to sort of see that again, unfortunately, there are many things linked to the onset of developing a difficulty. We always talk about accessibility and availability as two really important risk factors. So if you're in an environment where a substance is readily available and accessible to you, then obviously it increases the risk of you engaging in it and then potentially developing a problem with it. But as we mentioned before, the way I've sort of understood this difficulty is by listening to the person. So I can tell you from the literature, it's a biopsychosocial set of difficulties, so that there are candidate genes which predispose somebody to develop the problem, but not everybody who's got DRD2 dopamine receptor genes, which is one of the genes linked to addiction, is going to go on and develop the problem. So there has to be other things that may link to your environment. So one way that we sort of understand the risk factors is to speak to people about their life and how they developed the disorder in the first place. I'm just looking for it up on here, but somebody put childhood experiences, and we see that as a risk factor. It's very frequently endorsed by adults in treatment services that they've experienced an adverse childhood experience. And that can be different things. It could be, growing up without a parent, growing up in a household where drug use was rife, and therefore they were socialized into that type of behavior very early on. You also see some things which come into people's lives. So maybe you didn't have a problem with drugs or alcohol. I see gambling was mentioned, and it'd be sort of good to explore that as well. But then something's happened to your life, like a bereavement, like a divorce, as you can see there, that has led to somebody developing a problem as a way of coping. Again, coping's come out quite strongly there. So this adverse childhood experiences, which are traumatic, not being able to cope with adjustment difficulties in your life, like having a bereavement or divorce or problems at work, leads to stress, and it's a very accessible way of coping. And people tell us that they might start to use alcohol as a way of coping with difficult thoughts. And I'm sure you all know what happens there. You need more alcohol to cope with the thought, and you end up, becoming more tolerant to the alcohol. So you need to have larger amounts to get the same feeling, and that's the onset of the difficulty. So yeah, but I always think the best way is to try and understand what's happened to that person, what's brought them to this point in their life, and how can we support them to make some changes so that they don't necessarily need to rely on drugs or alcohol to feel a particular way or to escape a feeling. That often is something that's endorsed. I take this substance so that I don't feel this way. So it's a kind of an avoidance strategy for a lot of people as well. And then when you become dependent, it takes on a different type of function. You need to keep using to stop withdrawals, which are really unpleasant. And then it can become a harder challenge.
Thank you, Adam, and thank you to everyone that's contributed to that. So as we move on, and we've touched to some degree on some of the potential pathways towards addiction, and we've talked about genetics and the possibilities there. We talked about early childhood trauma. And I'm thinking here, when we talk about pre-existing mental health conditions, for example, let's say an anxiety disorder, someone's feeling anxious, they have very racing thoughts, they're worried about things, and they're thinking about coping mechanisms that they may be able to engage in. And some of those might be the ones that you, this concept of, or notion rather, of escaping a feeling. I'm also thinking about healthy coping mechanisms, and not to dilute this topic, but thinking, so people that, I don't know if this would be correct to say, Adam, or suitable to say, for example, people that are going to the gym, which is perceived as a very healthy a very healthy coping mechanism generally, but to the point that it's excessive and obsessive, and this may be as a result of an underlying thing that they're trying to avoid potentially. We think about addictions. I'm thinking about sort of behaviors that might involve alcohol and substance misuse, but maybe even this could be sort of considered an addiction that might not be healthy, but at the same time healthy.
Yeah, I think somebody put in the chat, what about gambling? So, I mean, we are talking about what you would see in treatment services, which is mainly people who've got problems with a substance, which, you know, we can kind of categorize those into alcohol, illicit drugs, so street drugs. Somebody also mentioned prescribed medication, which we call iatrogenic addiction, and you will have seen that a lot in the States, where there was over prescription of opiate pain medication, and then people developed addiction problems as a result of that. And sometimes we see people prescribe benzodiazepines for very lengthy periods of time. So that essentially is the same thing. It's that your body's got used to a particular substance, and the minute it's taken away, you start to have what we call withdrawal symptoms. So you feel the need to keep using to starve off the withdrawal symptoms. But there are services now in the NHS that focus specifically on problems with gambling. So you'll have seen the adverts that advertise gambling, but it's also about gambling safely. So you'll see the sort of messages at the bottom of the screen that flash up to say, take a break. GamCare is a charity that's been set up and funded partly by the gambling organizations themselves to support people who experience difficulties. I think, one way to think about it is an excessive appetite. There's a professor in Birmingham called Jim Orford who's wrote extensively on this, and he sort of describes any addiction as an excessive appetite to something. So something could be initially quite rewarding and in balance, but it quickly becomes out of balance because of an excessive appetite and ends up causing a problem. So it could be shopping, online gaming. There are also services for children and young people that focus specifically on gaming. So if that's monopolize the young person's time and other things are suffering as a result, maybe schoolwork and relationships, it could well be exercise. The key thing is that there's an element of harm. So whatever it is you're thinking about, whether that's drugs, alcohol, exercise, gambling, there's an element of harm that results from the person engaging in the activity too much. That could be financial harm, physical, psychological, familial, or employment harm. But that's the key point at which you would think that you might support somebody to get some help if it's beginning to cause them some harm, which of course is very difficult to acknowledge if you're going through it yourself. And sometimes you need work colleagues or families or friends to sort of help you understand that it's beginning to cause you some harm.
Thank you, Adam. I think that's a very relatable way. is it imbalance, and there's harm that results of the activity. So you touched on some of these already, Adam, in relation to some of the potential harms to the individual of addiction, and we'll cover it from the perspective of the individual, and then we'll move to talk a little bit about the potential knock-on effect for those that are surrounding those individuals, potentially family members, colleagues, etc. But the harms can cross across a range of themes here, right? It's not just necessarily related to one, whether physical, psychological. There can be many knock-on impacts of addiction.
Yeah, I mean, you will see A&E departments on Friday and Saturday night with people who've entered into A&E because of a drug or alcohol problem. If you've used for a long period of time, you may develop, if you're using alcohol, I should say, for a long period of time, you may be susceptible to liver damage, liver disease, so having a fatty liver or a cirrhotic liver. If you're somebody that's using opiates like heroin, there's a pretty significant risk of overdosing. Unfortunately, I mentioned the sort of overprescription of opiate-based painkillers in the States, and we saw a massive spike in drug-related deaths due to overdose because of that. And then there was a whole change in prescribing practices as a result. So, the harms are sometimes very quick and sudden, like overdose, or bloodborne viruses if somebody's sharing needles, if they're an injecting drug user. Or they can be quite insidious and cumulative, like a relationship breakdown, or losing your accommodation because you're financially not able to pay your rent or your mortgage. We mentioned right at the start that we'll be talking about harms because for this difficulty we associate multiple harms across all of those domains. So it doesn't just affect the person, it affects the people around them, and it also affects society because of the resource that we need to spend on providing treatment, which would be better spent earlier on in the process by thinking about early intervention. But it's the thing that we don't talk about is the person's potential, which I hear a lot when people talk to me about their problems with drugs or alcohol. I could have achieved this. If I didn't have this problem, I would have achieved that. So it's also, that's a very personal thing, isn't it? That it stops you from achieving the things that you want to in life, or it pauses them. So that again could touch on all of those points. But yeah, unfortunately, there are multiple harms as a result of this.
On the flip side of that, Adam, and maybe it doesn't verge into addiction, but you can get very high performing individuals that potentially have compulsive behaviors. Maybe they don't lean right into addiction, but potentially habits that are harmful for them, even though they are outwardly looking in high performing, whether that's within their roles and what have you. And I guess there's a sort of spectrum in terms of the severity of the addiction, but yeah, I'm wondering whether there's the sort of space to say that these can be behaviors that become addictive, but still people can contribute seemingly if you're outwardly looking in at their lives.
Yeah, I mean, if we sort of relate that to the workplace, you might say somebody works excessive hours and they kind of have an excessive appetite for work and they're really committed. I just wonder how long you're able to sustain that. So, we always say to our employees, you have annual leave for a reason, and that's to almost force you to take a break sometimes because, if you're in a job that's really busy and you care about it and you're good at it, you can over immerse yourself in it. But again, there's no balance, and that's what we're talking about here. If you have a problem over engaging in something, there's no balance, and oftentimes it's just about creating a bit more of a balance than you have. So, annual leave is a great leveler of getting a bit of balance back, or making what we would call reasonable adjustments in the workplace, so that just because somebody seems okay with taking on a whole bunch of work doesn't mean that they're able to sustain that. And we know from the literature, and I'm sure if you've been to any of our other webinars, we talk about, burnout and stress at work. So, and this could be quite a personal thing for somebody. They want to work long hours, they want to work hard because it started off being quite enjoyable. But I think as we're talking here, if it's out of balance, it can create harm. So one of the things we would sort of ask you is to just monitor that yourself and in your colleagues as well, because again, sometimes it's really difficult to reflect on your own performance, and that's why we have supervision and line management and peer meetings to sort of just say, hey, I've noticed you're working a lot of hours, I'm just wondering if you've got the right balance. So burnout and stress are real things, and it's kind of similar in the sense that you over engage in an activity, this time work, and it begins to cause you some harms.
Yeah, I think it's a really important point, and I'm sure if we could see more faces, there'd be a few nods on camera. We certainly see that in our other webinars, and particularly around the topics of stress and burnout and people sort of working to excess. So it's an important topic to discuss and to highlight. So how would we approach this discussion, Adam? So we do a lot of awareness raising. We do training for organizations in respect to spotting the signs of mental health challenges, noticing changes in behavior, things that are atypical. I think you described it as last time we were talking about spotting the signs of someone that may be struggling. But yeah, I wondered if you could expand on how we might, in ourselves, if we were particularly someone that's experiencing challenges, maybe verging into addiction. You've spoken about excessive appetite, things not being in balance, and then thinking about how we might look around ourselves, whether that's within the workforce or potentially family members, friends, etc. How we might recognize some of these signs.
Yeah, I mean, it's quite difficult, isn't it, for ourselves to sort of reflect on our own behavior and recognize that something's not quite right or beginning to cause some distress. And you see that a lot with people who've come into services. They have struggled with these sets of difficulties, usually on their own, for a long time before, hitting rock bottom is the way that it's been described to me. So something has compelled them to come into treatment, usually, an A&E admission, or a difficulty with the criminal justice system, and that's compelled them to come into treatment. So sometimes it's really difficult to sort of reflect on your behavior, particularly as we've said that it kind of creeps up on you. So, you often hear people say, oh, I didn't realize I was drinking that much, or I didn't realize I was smoking that amount, or I didn't realize I was doing those things. It's really quite difficult, but you'd pay notice to changes. So you would notice differences in perhaps the way that you think and feel about things. The really good indicator that something is coming out of balance is if you're spending more time trying to procure it, using it, and recover from it. So, one example might be that you were a social drinker, for example, and you would go out on Saturday night with friends, and it would be a social experience, and you wouldn't get into difficulties the next day, and you'd be able to fulfill your commitments and obligations. But you might notice that becoming more frequent. So instead of just the one day, you're going out 3 times a week, and you might notice that you're missing work because you're hungover, or you're waking up late, or you're not playing for your football team, or you're not taking your kids to school. But that's difficult because of the reasons you've said, which is that, there's still, unfortunately, a lot of shame and stigma associated with this. And it's really hard to sort of, accept that there's a problem, which is why we're sometimes reliant on other people. So if you're, the partner of somebody, the work colleague of someone, and you begin to see certain things that might suggest they've got a problem with drugs, alcohol, gambling, or some of the other behaviors, it would be that thing you would look for changes. So something that isn't typical of them. So maybe they've got financial difficulties because they're spending their money on drugs or alcohol. Maybe they're not meeting their commitments frequently, so they're constantly away from work, or they're constantly not turning up for things. Maybe there's a change in their interaction with you. So maybe they avoid seeing you because they don't want you to see how they really are. And when you talk to people who are in treatment services, it's a common theme. I hid my problems from other people. It's often described as the hidden harm because it's not always the case that people feel comfortable telling others about this problem. And oftentimes people often say that they've kept it a secret until it's got so bad that they needed to get help. But it's those sorts of things, changes in, physical changes as well. So somebody may lose a lot of weight, gain a lot of weight, neglect their appearance, um, stop showing an interest in hobbies that they were usually always interested in. So as Rich said, it's things which are atypical for the person. So changes really, present an opportunity just to sort of check in with someone to make sure that everything's okay. And we'll talk about how you can do that a bit later on.
Fantastic. Struggling to get myself off mute there. So if we have a look now and sort of explore these two sides of the coin, if you like. So the difference, if you like, between what could be a bad habit and something that could be classified as an addiction. And I think we've spoken quite considerably about things being in balance, but I wonder what else there is to kind of highlight when we're comparing these things, what might be habitual versus an addiction.
Yeah, I mean, I think as you can see there, the difference between the two is the harm that occurs as a result of the behavior. So, a habit doesn't have to be bad, right? It can be something that's quite productive, protective, and the difference. So we could be talking about the same thing. So Rich used the example of exercise. So you may have the habit of exercising every day for a set amount of time, and the physical well-being benefit and the emotional well-being benefit is protective and important to you. Sometimes we think of these things on spectrum or a continuum. So on one end you've got no harm whatsoever, and on the other end you've got as much harm as you can possibly have. And that changes over time as well. So maybe drinking at one part of your life is in the habit safety zone, but then something comes into your life like a bereavement or a divorce or some other issue, and it veers over towards the more harmful phase. So the same thing could be okay and relatively protective, but also the same thing could be quite damaging. As we're talking about that, you might be thinking, well, what about street drugs? They couldn't possibly be protective. I mean, sometimes people tell us that they are. Our advice, obviously, from a health perspective, is there's probably nothing protective about it, but their perception is that it is. It helps in some way. I know the harms that it creates for me, but it helps with this thing. And that's why it's so difficult to change it or to, abstain from the thing that's perceived, that's got some sort of perceived benefit, even though it probably doesn't. So the same thing can be, both protective, but also veer into the harm causing category.
Thank you, Adam, for those insights. So yeah, we discussed briefly on a couple of previous slides around the importance rather of potentially spotting those signs in somebody else versus yourself, and some of the do's and don'ts we've sort of highlighted here in terms of approaching that conversation. And I know approaching a conversation generally, there's sometimes a lot of the people that we deal with and speak with are empathetic and want to help, but then sometimes there's a slightly apprehensive nature to some people because they don't want to say the wrong things, they don't want to do the wrong things, they don't want to accuse someone and they get it wrong. Yeah, any sort of observations from what we're seeing here, Adam, and in terms of the do's and don'ts and how to approach conversations with people or to support somebody?
Yeah, I mean, it's really difficult. I mean, how do you support somebody that perhaps doesn't want to change? It's really difficult. And oftentimes you may see well-intended action creating more harm. And you can probably think of what I'm referring to there. So you may give somebody money to procure alcohol or procure drugs because you see the pain that they're in, both physically and emotionally, and you want to help them. And that might feel like the right thing to do, but obviously it's just delaying the difficulty for a lot longer. So there's various ways that you can support somebody. Oftentimes it's just simply not doing the things that could harm. And again, that's really difficult. But if you can imagine, how can you support somebody to make a change in relation to something? It's by being with them and going alongside them. It's not about fighting them. So oftentimes, if somebody has a problem that they haven't taken action to resolve, we might say that they're not motivated to change. And sometimes that's not the best way. They might be very motivated to change. It just might be the case that they don't feel able to. So our job then is to sort of give them the resources so that they're able to affect some change. That could be something really quite simple, such as don't criticize, don't nag them, don't lecture them, because we know those things are more likely to make somebody pull away. And it kind of makes sense, doesn't it? It's really, really easy to do that, and it's very appealing to do that, which is, it might be a statement like, well, why don't you just stop smoking so much? I'm sure they've thought of that themselves, and we're not telling them anything that they didn't know. But those things can really harm their motivation to make a change. So, you know, providing that support around somebody is to just have, what we call a compassionate conversation. Nobody's expecting you to have the answer, because it has to be the person themselves that are willing, ready, and able to get the support. But you can do very simple things like listen to their perspective, understand where they're coming from without judgment, because maybe they've had judgment when they've told other people, and that again really harms their willingness to get support. It could be really practical support. So it could be taking somebody to go and see their GP. It could be supporting them with maintaining accommodation or their job. So it doesn't have to be emotional. It could be more practical support. All of those things might, create the scaffolding around them so that they can make a change. So oftentimes it's not so much do these things, it's don't do these things, because they can really harm somebody's motivation to get support. But we always say, it's difficult when you're given the information, because it's difficult to know what to do with it, and it does create a bit of burden on you. And it can feel a bit overwhelming, but there are some simple things you can do that don't require, years and years of training. Just by listening non-judgmentally, I think, can have a massive impact on the way that somebody thinks and feels.
Thank you, Adam. I think something that resonated there that, I guess it makes sense if you are being critical, and then you're potentially creating even more space between the person that might be able to support them and be that ear that can listen. So yeah, I don't think as you've said, any of this is easy and straightforward, but there are some considerations that you can give to how you approaching somebody. So we spoke at the beginning about organizations that are out there to support people that might be experiencing addictions. And then we wanted to spend a bit of time sort of picking up on this notion of peer support. And I guess the role of peer support, Adam, in and amongst professional treatment where it's relevant to do so. Do you have any thoughts around sort of impact that peer support can have on individuals either that you've dealt with in your clinical practice?
Yeah, I mean, I always suggest people go and make use of this support because, if you turn up to a healthcare service, it's usually open 9 to 5. And if somebody's recovering, get there between 9 and 5, and usually can't access it every day. Whereas, when we mean mutual aid, it means people that have lived experience of the difficulty that you're struggling with. So, sometimes you want to see a clinician who is an expert by occupation, but sometimes you want to speak to somebody who's been through it themselves and understands what you're going through, and more importantly, has come out the other end. So mutual aid and peer support is a great way for somebody to get support from people who've got the exact same set of experiences as you. Um, so you can attend these meetings any day of the week, pretty much across the world. There's a great opportunity now to just dial in through Zoom or through other mechanisms, so you don't physically have to be there. And that's great if you've just had a really difficult day and your appointment isn't until next week, but you need some support there and then. So that becomes a support network in addition to whatever treatment you're receiving. Some people don't want to access treatment and just want to access mutual aid and peer support. And sometimes in the services, there's mutual aid meetings. So the services that I've worked in, AA have been there holding meetings, NA, Gamblers Anonymous, they've been there holding the meetings in the service. And, it works really well when it works in parallel. The important thing is people have a choice. They have the choice to sort of say, I think that works for me, and I want to do a little bit of this, but I found this really useful and I want to do more of that. So it's just about, offering people more choices with regards to support and for them to figure out what works for them. And this definitely works. There's just no two ways about it. It's a really important resource for people who are struggling.
Thank you, Adam. So, I think here what I was trying to get at is just to understand from people, how long they think these things take to recover from. Obviously, there's not one timeline associated with this, and maybe Adam, just to touch upon once people have had a contribute to this slide, whether recovery is possible or whether it's something that we just kind of, get and develop better coping mechanisms and it's something that people live with, or actually, yes, it's absolutely possible to recover from addictions. So we'll let people to or engage rather with the slide. So yeah, a few different comments from a few years, no average time, and I think that's probably a good answer there. A very long time, a lifetime. Ongoing recognizing triggers. So yeah, we've got some good participation there, and in the interest of time as well, we'll move on. But maybe Adam, in terms of supporting people that you've encountered, I'm assuming it really very much depends on the individual presentation, the challenges they're experiencing, as to how quickly someone can recover from an addiction.
Yeah. I mean, it's a bit of a trick question, really, because, I would probably answer depends what you mean by recover.
Yeah.
But I think, yeah, somebody's put there's no average time, which I think is probably the best answer to that question. I mean, you can be detoxed from a substance within 5 days. So I guess technically that means you've recovered in some respects from the drug, right? But you haven't recovered from all the other bits that were important in you having the difficulty in the first place. So, we made reference to mutual aid. Some mutual aid organizations would tell you that, it's a lifetime commitment and that you are an addict and that you have to surrender yourself to your addiction and that you need to keep working on it every day for the foreseeable future. Other people, you know, step out of services having recovered and come back in, and they're able to sustain their recovery. If you look at the literature, they talk about sustained recovery, and I think they kind of describe that as anything over 3 years, so a period of sobriety over 3 years. I've met people who consider themselves recovered because they've got their, alcohol use or drug use down to once a week, and in their mind, they're recovered. So it's kind of, the answer to that question is it's a personal experience. It's what a person might define for themselves as recovery. If we make the parallel with mental health, we wouldn't necessarily say the only way you can recover from a mental health difficulty like depression is never to have symptoms. That's just not sensible for a lot of people or achievable. So we might say you've recovered when you no longer experience the degree of impairment that you experienced previously. So it is kind of a very personal way of describing it. And depending on, what your view on this whole concept is, that could be a lifetime, and I'm always in recovery, and I always need to be vigilant, or it could be that was part of my life then, it's not part of my life now, and I managed to make the change in, that amount of time.
Thank you, Adam. So, if we can, Adam, in the interest of time, this is the first time we've run this particular session and slide deck, so it's always a little bit experimental when you're judging the sort of cadence and of the session. But in terms of treatment options, here we're highlighting various different things from psychological support, and you highlighted that there may be more appropriate routes for somebody that wants to engage within peer-based support, as well as sort of traditional therapeutic approaches and other things that may be helpful for the individual.
Yeah, I mean, people will be aware of the treatment options. For some people, that might mean going to a place and staying there for a period of time. So it might describe that as an inpatient rehabilitation program. Other people, it might be, getting help virtually, and really focusing on your psychological adjustment. And for other people, it might just be, I need to talk to that really supportive friend who knows me very well, and I get the most benefit from them. So yeah, the main thing is that, some treatment options are restricted because of things like cost. So they're not available to everybody, but others, like mutual aid, are available to everybody and there's no cost.
Thank you, Adam. And yeah, so we've kind of summarized this on a couple of slides before around the recovery, and it really depends on what your definition of recovered is in this concept in this discussion. But this is possible depending on how you view that. And then we've spoken about various treatment options for individuals. And then if we bring it back to the UK setting where we're based, you can see around some percentages of people that are in structured treatment who complete that successfully, and other positive outcomes associated with those that are engaging in support, the role of early intervention, and the role of social support and peer networks. So there's two main things that I want to make sure that we cover before we cover off. Briefly touching on this, Adam, in terms of these adaptive and maladaptive coping mechanisms. We have spoken about coping mechanisms to some degree, but on the next slide, if we keep that in mind, this sort of notion of riding the wave and perhaps resisting urges. I wonder if you could talk a little bit to that, perhaps from your observations of working with people. Maybe there are certain things that an individual can do when they have these urges, whether that's sort of from a cognitive perspective or grounding themselves to try and not be impulsive in the moment.
Yeah, I mean, it's exactly that. So I think very early on, somebody put up impulsivity as a factor that we associate, and that's true. So part of the way that somebody might make change is by not giving in to the thought or craving or urge to smoke a cigarette, to gamble, to spend an hour online playing a game. So there's a cognitive and a behavioral component to that, which is we've said riding the wave, and the concept of the wave is a surfer staying on the board, and the wave will eventually extinguish itself. So it will go away, or it will become less powerful as time goes by. So we often sort of teach that as a skill, that don't give in to the impulse to have a beer just because you've seen an advert for beer on TV. It's, loose associations like that can set off an urge or a trigger that you then engage in, and that could be, the beginning of somebody having a problem again because maybe they didn't have any alcohol for a week. So there's some definite skills that or coping strategies that people can utilize to make sure that they don't drink again when they've had a week of not drinking, or use again when they've had a period of time abstinent from substances.
So we've covered to some degree some of the impacts on family members, on dependents, people around them, some of the things that individuals can do when they are trying to be supportive, some of the do's and don'ts, but just highlighting those for you again. And needless to say that this can be a really emotional, taxing time for those individuals that are supporting people that are impacted by addiction. And we wanted to bring, as we come towards the close of the session, we wanted to bring the discussion back to the employment environment, to the organizational environment. So we know that there can be knock-on effects of addictions in terms of rates of absenteeism, potentially an impact to productivity for those people that are struggling with challenges associated with addiction. And there can be a reluctance to seek help for various reasons, but if you think about job security, potentially that's going to be one of the things that's going to be on somebody's mind. But we know that we work with some forward-thinking employers who do create supportive environments, and that's the next thing that we wanted to discuss with you. Some of the things that employers can do. In the interest of time, we're going to go straight into what we think are some of those things, not the exhaustive list. So we're going to skip past, unfortunately, the Slido. We know for next time we need to push on a little bit quicker, perhaps remove a couple of the slides that we got. But these are some of the things that an employer can do. So policy guidelines. So I guess that's more in relation to their policies towards drugs, to substances, substance abuse. I think it's a bit of a no-brainer in terms of providing access to support and treatment, visibility of services that can help people, where appropriate, potentially referral to local treatment centres, and moreover, just fostering a good conversation, an open conversation, much like mental health, trying to create an environment where people can discuss these issues and feel supported by the people that they have around them, potentially verging in the area of training. So we do a lot of training in respect of mental health awareness, supporting people to spot the signs in themselves, in others, but moreover, creating an environment that is supportive of their employees. And what we wanted to do to close, because it is 1 p.m. now, is to summarize the key messages and then give you a quick highlight of the Thrive service itself. So we've spoken about this issue of addiction. It's complex. We've spoken about this sort of excessive appetite when things aren't in balance. You've seen how some of these themes can impact individuals, impact those people that are caring for those individuals, and impact organizations. So hopefully a useful discussion. I know I've benefited a lot, Adam, for having your insights and clinical expertise to bring this discussion to the audience that we've got. And we did want to highlight that you do have, as customers, employees that have access to our app. We are not talking about a addiction specialist service here, but we do support individuals who are struggling with their mental health to help them support and unpack and meet them where they are. So there is the opportunity to download the Thrive service. If you haven't done already, you scan the QR code and your organization will be able to provide you, or we can, if you email us, your unique access code to access the service. So slightly overrun, so apologies for that, but thank you for your engagement in the discussion. Hopefully it was useful and insightful. Thank you for your comments. Thank you for the participation. And as Ella's put in the chat, in the webinar chat, if anyone requires assistance with their access code, you can email us on help@thrive.uk.com. So enjoy the rest of your day. We're going to close the session there. And thank you for joining and hope to see you again soon.